Part of it is we could probably do a better job in identifying or trying to identify those people at greater risk. So doing a more extensive evaluation on, for instance, those that we know have asthma. You know, some I think don't even know they have asthma when they go over and it flares up over there. You know, trying to keep those people away from these environments. Smoking's a harder issue because, you know, I'm not sure of the, while you don't want them to chronically smoke and you don't want them to continue the habit, how do you tell them no in a theater of operations where people are shooting at you and you're in harm's way all the time? So it's difficult to really balance, you know, those that are going over there and, you know, and people smoke for a reason and sometimes a very calming effect on them and they like it. Now obviously the long-term effects are not good and we don't want anybody smoking, you know, back in theater and whatnot. And I know there's some pushes right now by the Army to try to minimize the amount of smoking done by the troops and the availability and things along those lines, you know, to try to make them as fit and as healthy as possible. So clearly there are individuals, for instance, I mean, the Special Forces guys that are in a very different environment than many of the people that get deployed, and so you have to be a lot more, you know, specific, a lot more careful with who you send over and who you don't send over. So in a lot of instances, even before they deploy, those that have higher exercise requirements will sort of weed themselves out in some ways. And so we don't look just specifically at the, oh, you're deploying, you know, you can't go over there because of this. We look at the job, we look at the disease that they have and the severity of the disease and how much treatment that they have for this. And we know, for instance, that people with bad asthma or who have a lot of medication for asthma are not going to do well in that environment, so we try not to take them over. We're not aware of everybody who has asthma, and they're not